All right, so welcome back to this episode of Your Health, Your Story. We're doing a short one, again, keeping it to 15 or 20 minutes or so. And this one, I wanted to switch it up a little bit and talk about an article we published back in 2013, almost 10 years ago now. And to help me out and go over this article, which is really going to talk about nature versus pharma in fighting not just epidemics and pandemics, but infectious disease in general. I'm going to bring on one of the writers, a very close friend of mine and a stress and recovery expert, also the co-founder of Reorigin, Ben Ahrens. Reorigin's a neuroplasticity company to help people overcome chronic illness and return to feeling they're living their best lives. And Ben, thanks so much for coming on and helping me out here.
Yeah, Casper, my pleasure. Thanks for having me on.
I want to go ahead and actually share my screen here. And I understand for those listening to audio, this probably won't help too much, but we will go through a bunch. And can you see my screen right now?
Yep, looks good.
Cool. So we published this article back in 2013, right? And I found this and said, we got to go over this because it has so many commonalities with what's going on right now, we've been going through the last 2 years. And this was back when the flu was considered in its pandemic stage or even an epidemic. And we had a really bad flu season. I remember that year, and there were so many people talking about the flu vaccines really helping to, fight this pandemic and fight the flu in general. And we wanted to outline the pharma route versus a natural route. And do you remember writing this article? Because I know you were the chief writer in this article, right?
I do, yeah. And I feel like a lot of things came together, research, ideas, philosophies that we'd been talking about for a long time really, came together in what turned out to be a very succinct article. But, the main kind of core of it, if I could just summarize, is really a testament to the body's ability to self-heal and the immune system's ability to fight off pathogens. And this is something I know we've spoken with many even conventional doctors who have said things like, no amount of pharmaceuticals or drugs will ever amount to the power and potency of the body's own immune system. So I think with this, we really just wanted to highlight, the kind of biological medicine perspective that the body is this incredible self-healing system that has just about everything it needs innately to recover, to fight off pathogens, to organize all of its systems and functions in a certain way, and just to sort of put question marks on what's going on outside and really turn the spotlight on how amazingly capable the human being and the human body is.
Yeah, I'd love to go over a few of the pieces here within this article that really highlight what was going on then and how that relates to what's going on right now, and how history may not actually repeat itself always, but it does have those patterns and it likes to rhyme. So, one of the things I was reading, right at the top was this quote that came from the Gazette there that said, existing vaccines miss significant quantities of the flu virus. This was about the flu circulating in any given year. And now you're talking about something that had years and years of research going into it, the flu virus. And I believe even that year it said about 30% of the people who got the flu got it right after getting the flu shot. That was documented. And you could even go further down this article and read some of the actual research that came out that said, notice in the early weeks of the 2009 H1N1 pandemic, that people who got the flu shot for the 2008-2009 winter seemed to be more likely to get infected with the pandemic virus than those people who hadn't received a flu shot. And that was through 5 studies done in several provinces in Canada at that time. What is it, Ben, about medicine that doesn't seem to look back in history and take that into account? Because it seems that what we're going through right now is exactly the same thing that we wrote about back in 2013 that was relating to 2009.
I actually think that this says more about the human being and the human brain than it necessarily does about the field of medicine, which is that our reactivity, during times of stress, acute or chronic, like we're going through now with, lockdowns and all these situations, it's been shown even through like fMRIs that the brain tends to shut down the prefrontal cortex, which is like this region of the brain responsible for long-term thinking, strategic planning, the ability to, see things out in the future. And really basically exacerbates or activates the limbic system, which is more of our primal part of the brain, right? That's like fight or flight. That's like, what can we do right now? Even dating back to the 1920s, Rudolf Steiner is someone that wrote about this. He was saying that, sugar is something that's responsible for narrowing our focus. And of course, we know that sugar, affects our blood sugar, insulin levels, and of course affects the brain, and essentially, makes us act a little bit more short-sighted. So I think it's kind of natural in a way that whenever there's times of acute stress, there's a lot going on. We're going to focus on the short term. Mm-hmm. I think what we want to do, and what came up for me when researching and writing this article, was trying to ensure that we don't also lose sight of the long term, and kind of recognizing what context we're in when we talk about things. Like you and I have always talked about, when you see articles in like the New York Times that say something like stretching, good or bad, or this diet, good or bad, without really placing any context around it. So similarly, when it comes to treating any sort of pathogen, but in this case, this was H1N1 or flu, using vaccines or anything else, the discussion around, is this good or is this bad, really, I think, needs to be far more nuanced than it currently is. We need to take into account the context. Are we talking about, is this good or is this right for society or for the individual? Is this good for the short term or is this good for the long term? And once we understand which of those four quadrants we're standing in, only then I think can we actually even begin to have an intelligent discourse around determining what would be the best way forward.
Yeah, and let's carry this over then, because I agree with you 100% on everything you're saying there. But let's carry it over, because a lot of people see these pandemics and these epidemics of viruses like the flu or like coronavirus, you could say, as short term in their own right, that they would be over, apparently it was supposed to be 2 weeks to flatten the curve, or 2 years, but we don't expect this to go on forever, hopefully, fingers crossed. But we do expect chronic infectious disease to go on, like Lyme disease and tons of other infections, that EBV, Babesia, Giardia, any type of infection you can name that can be chronically held and cause serious repercussions. How can we take what we're talking about here and apply that to chronic disease? Because in this discussion, it is a lot about, I think, healability in nature and going that natural course, improving your immune system, a slower process, versus the short-term citing of pharmaceutical intervention, which goes after symptoms and tries to, look at the germ. I think, what this comes down to, and we've talked about this a bunch, is that kind of terrain germ theory and how you look at both sides of that. Whereas in pharmaceutical, you look at the germ, you isolate it. That is the bad thing. We have to attack that. In European biological medicine, you look at the terrain and you really work on that and cleansing the terrain where the germ can't work. But I know you have a feeling it's kind of in the middle there. So can you explain what your kind of stance is on how we could apply what we're talking about here in pharma versus nature to chronic infectious diseases?
Yeah, sure. Whenever we're talking about any sort of treatment, whether natural or pharmaceutical, I think we have to also include in our line of thinking and include in the discussion the body's role, and how we can not just use these tools available to us to, influence the body in a positive direction, but also how we can prime the body or optimize the body to do what it naturally does. I think the failure to discuss the body's own capabilities is kind of missing out on more than 50% of the whole conversation here. And to me, this is the most fascinating part. So it's really, not necessarily just a question of, is this thing going to help us or harm us, but also really, first and foremost, what can we do for our own health, to support our own body, mind, immune system, nervous system, everything else, so that natural state of health really can start to prevail.
Yeah. And I read this last line, and, you wrote this, so I find it interesting talking to the writer about this, but the time is now for us to use what nature has made available, focus not on combating viruses, but instead on increasing our innate ability to heal. and call that progress. Now, he wrote that in 2013. Can you imagine if we took that to heart? Do you think we'd be in the position we are now in 2020, 21, 22, where we're fighting a pandemic and doing it this way, if we actually applied that medicine, applied that back then?
Yeah, I mean, to me, and I'll be very honest, like I don't have a broad spectrum opinion on vaccines, on like, is this positive or negative?
Sure.
My outlook on it is really, I think for some individuals, it's absolutely appropriate. Obviously, if someone is high risk, if they're going to be around a lot of people, like absolutely, in that case, it absolutely makes sense. I guess what I would want to see pretty much across the board, or really make sure, if I could have any say in how people are treating themselves and how, the state of medicine is being practiced, it's that let's do what we need to do to solve the problem in the immediate, to treat the symptoms. We're not opposed to treating symptoms, but let's not lose sight of our body's own healing nature. Let's not lose sight of doing the things that we can do on a daily basis. Pretty simple practices, right? Like some lifestyle stuff, reducing stress, changing even our mindset to, change our stress response, proper nutrition, good sleep, all these things that are not new to anyone, but that we so overlook. Let's not lose sight of those simple things that we can do to really help ourselves out long term, so that when we use these tools that doctors and pharmacies and technology creates, a lot of which are extremely valuable, that we're not using them as a crutch, but we're using them to enhance ourselves or to bridge that gap so that we can resume our best way of life.
And they are tools at the end of the day, and tools by nature are neutral. It's what we do with them. It's how we apply them. We always talk about this when we kind of, discuss whether something, like you said, is good or bad, right? Is a surgical knife, scalpel, good or bad? Well, in the hands of a trained surgeon doing a surgery that is required and life-saving, it's an incredibly positive tool. In the hands of someone who doesn't know what they're doing and nicks an artery and kills you, you're a murderer. That's not, that could be seen as a negative side of it as well. And everything has that, whether it's pharmaceutical, drugs, or even nature has that polarity to everything. And I think you got to find yourself in that gray, in that middle ground of it all, to not demonize pharmaceuticals, vaccines, anything. They are necessary. But to also understand, how do we look at that more long-term natural healing side that we all embody within us? How do we appreciate both? How do we find ourselves saying they're both necessary? They're both there. And really quickly, if you could just bestow upon the audience 3 tips you would recommend to boost our innate self-healing side of us, what would those be?
Yeah, sure. I would say the first one is actually mindset. This is so huge, and we're seeing more and more of this in the media. But as I've been learning more, because I'm always continuously fascinated by it, I think a key thing to remember and a key mindset is that stress is not inherently bad. We can't really choose or predict or have any control over the circumstances. But simply by doing something as easy or simple as shifting your mindset around how you perceive a stress, like a lockdown or negative news or something, research is coming out, which is really exciting, to show that if you simply change your perspective from seeing this as a threat to seeing it as a challenge, and you can do that through self-talk, you can do that through imagery, but simply shifting that mindset is actually sufficient to change your biology, to change that stress response that happens within us from the threat response, which is catabolic and inflammatory, to a challenge response, which actually motivates us in a positive way and has anti-inflammatory properties. So I would say the first one is anything you can do to change your mindset, just consciously intervene. The second one I would say is calm the nervous system. So this is more on a body level than a mind level. It's just doing things like deep breathing, cold showers, in activities that calm you down, things that you enjoy. And then the third one would be elevating your mood. And these are 2 things that I think a lot of people think are at odds with each other, right? Calming the nervous system and elevating your mood, because we really think of like boosting your mood, like Tony Robbins jumping around and everything and getting your heart rate up. But in fact, being in an elevated state or elevating your mood could really be as simple as just savoring something, like savoring a cup of tea, or being outside, feeling the sunshine on your face and savoring that moment. And when you do it that way, you can actually kind of simultaneously calm the nervous system, elevate your mood. And that tends to be an optimal state for immune system to come back online, for the endocrine system to come back online, and for healing and recovery to naturally resume.
And a lot of what you're talking about is what your work with Reorigin is doing, correct? Because that's all about your mood. That's all about the brain, neuroplasticity. Really quickly, with just the last couple minutes we have here, tell us a little bit about how people can utilize Reorigin, this program you're working with, to do those three things that you just talked about that are so imperative to health.
Yeah. So, kind of just like riding a bike, whenever we're trying to find a new routine, a new habit for our brains or for ourselves, we first have to kind of clunkily go through it. We have to remind ourselves and figure out, what tools am I going to use? How am I going to, change my mindset? What are those activities I can do on a regular basis that will calm my nervous system and elevate my mood? But the next phase, and what we really focus on at Reorigin, is conditioning those. We help people to really find those tools for themselves and then give them an actual protocol to use, with lots of repetition and lots of hand holding at first, but something where they can actually condition that new state of calm mood elevation as their sort of default state. And again, this is proven to be now time and again an optimal state for healing and recovery to occur, because we know that when we're in that chronic fight or flight state, the immune system takes a backseat, digestion, absorption, anything related to rest and digest or healing, by definition, almost takes a backseat for the fight or flight response. So if we can not just calm that at will, but condition that state so that we don't even have to think about it, so that our body just naturally defaults to calm, even in the presence of these stressors or negative news or anything, I think that's something that we're finding more and more is extremely valuable for people. So, for anyone who might be struggling with whether it's symptoms of anxiety or chronic fatigue syndrome, burnout, depression, or even recovering from a long-term chronic illness, this is something that we've created to really, supplement that treatment and help them on that path to recovery. And they can go to reorigin.com. It's with a dash, re-origin.com if they want to learn more.
I mean, so basically it's for everyone, right? Because we're all dealing with this right now. There's no way
I didn't
around
want to say
it.
that, but it does seem like
that's
hard to find someone who could not benefit.
Right? That's the sad fact of what we're going in right now. And that's what I'm seeing throughout all patients. Patients are really just a subset of what's going on in society. They're just exhibiting the most and seeking the most solutions in a sense. But it is a reflection of what's going on. You have so many patients that are so stressed out, so burned out. That mindset is not there. And that's the difference, I think, of the modern day patient. And that's the difference of why we talk about nature versus pharma, where people are relying too much on one side or the other, mostly on the pharma side right now, and not addressing those pieces of the mindset, the ANS, and everything else that is essential to get yourself back into health. And you can't just do that through a pharmaceutical intervention. So always love talking with you, Ben. Such a great discussion. Casper. Let's do it again soon. And anyone listening, Reorigin, great program. Utilize that. And remember, nature is your friend. You are a part of nature. This is how we heal. Get that self-healing ability up. Reconnect with nature. Thanks again, Ben. Take care.
Thank you.